Hey, also, since our last council meeting, I have been able to come up with a few points that I wanted to share with you all on why I believe that having an on site interpreter as opposed to the language line would benefit us much more as an office. So, I have seen in my personal life and my professional career how Spanish speaking patients fail to properly understand their medical diagnosis and treatments. Understanding those two, we know that it's critical to a patient's well being as they may procrastinate on getting help or the treatments that they need, or they may forego treatment altogether due to not understanding the gravity of the illness. So, this connects to us as an office because I know that we have implemented the language line in order to communicate with patients. Um, but I feel like our office requires something more to help these patients. We need to push forward and try to implement something that we know is really going to help these patients understand. Sometimes they're leaving the office confused or still asking the front desk questions about what happened during the visit. So I know that the language line currently requires the clinical staff to call and request an interpreter in order to communicate with the patients who speak other languages. And then that interpreter is to do the interpreter over the phone. I believe that this creates discrepancies because effectively communicating is much more than just hearing. Many patients from other cultures use much more to communicate, like gestures and even facial expressions, which are all things a language line interpreter just simply won't see. So, there are multimodalities in language, and a theory that I have looked into is a theory by Kress, which looks at how people communicate and interact with each other through speaking, writing, gesture, gaze, and visual forms. So modalities may include gestures, and in many different cultures, they are used to communicate because an interpreter using a language line cannot see these gestures. It can cause a discrepancy in the communication between the interpreter, the doctor, and the patient. And when it comes to healthcare, there's simply no room for error. We want to make sure that our patients are confident about their healthcare and the information that they are receiving. So, another point is that just like the way something is said in English, um, it can mean something in English, but it can also mean something completely different in Spanish. So, there are many words in English that mean the opposite in Spanish, and that can cause confusion. So this multimodal theory by Kress relates to this problem in my, in the current problems that we're seeing in the office, because the patient-doctor interactions require conveying correct meaning of medical diagnosis and treatments. Treatments that are critical to the patient's healthcare and well-being. And you guys all know that. I mean, we just want them to feel confident about the information that they're receiving. We don't want any critical information to go, um, you know, without being told to the patient. So through the simple use of a language line where the patient can only hear what an interpreter is saying, but not be able to match the gestures or the facial expressions to understand fully what is being explained, that can be very tough for the patient. So there's always, that chance that the patient may be confused or not understand what is being explained, which, it it poses a great risk for the patient and the clinical staff as well. Doctors and nurses and even the front desk as well. And so I have these diagrams here. And so the first diagram, it's labeled the root causes of patient safety events. So these are the main root causes of patient safety events seen in, hospitals, doctors' offices. So patient safety events or greater risk for medical errors. So we're going to start from the bottom. We see that language barriers and limited English proficiency will cause those communication problems, which will lead to the patient safety events or greater risk for medical error. And then we also have the cultural barriers and those factors as well, which will, obviously lead to the communication issues and then lead to a patient event or a greater risk for medical error. And so at this diagram down here, I mainly wanted to show you guys this one because, we are a doctor's office and, although we are not public, our patients, we still have a large volume of patients. So For doctor's appointments here, it shows that almost 70% needed an interpreter on site to help with the visit. So that just goes to show how important it is to have an interpreter in the medical office setting and in doctor's appointments specifically. So imagine going to a restaurant, misunderstanding what is on the menu, and being disappointed because you didn't get what you ordered. That is what is seen in the healthcare field on a daily basis because of language barriers and discrepancies in communication. Sure, getting the wrong meal, that's upsetting. We can all say that, but certainly not as critical as misunderstanding a medical diagnosis or a medical treatment explanation. So, a physical and on site interpreter all day is what I think can help our office. It can help eliminate many of the discrepancies we see in our office, fully understanding that there is much more to communicating than just, listening. Really understanding someone requires physically seeing and understanding gestures like the facial expressions, the eye movements, gait, that's a huge one for us, and simply much more. So by implementing this, we can make sure that that not only patients but doctors and the clinical staff, they can feel confident about the information and the feedback that we are giving out during the visit, and the patient can feel confident about the information that they are receiving during their visit. So it's time that we start seeing this as a major issue within our office. Being able to communicate with patients of all backgrounds is important, and making sure that patients feel confident about the care they are receiving is definitely priority. Thank you, guys.